The Agenda with Steve Paikin is made possible through generous philanthropic contributions from viewers like you. Thank you for supporting TVO's journalism.
Case counts are way down. Vaccinations are way up. These are good days, heading hopefully to better ones when it comes to tackling COVID-19. But the past year and a half has been brutal for too many. And tonight we'll ask Ontario's Minister of Health, Christine Elliott, about the government's handling of the crisis and what's ahead. Then we'll find out why the City of Hamilton is taking its time accepting billions to finance a light rapid transit line. It's Wednesday, June 23rd, and that's ahead on the agenda. The last time we had Health Minister Christine Elliott on this program, she was here to talk about implementing transformative change in healthcare. None of us then expected what would come to dominate and define her role would be a global pandemic. But that's where we are. So we're happy to welcome back from the downtown of the provincial capital, Christine Elliott, the PC member for Newmarket Aurora, Deputy Premier of Ontario, and of course, Ontario's Minister of Health. Minister, it's good to see you again. How are you managing?
Oh, very well. Thank you, Steve. It's been an interesting year, to say the least, but things are looking much better for everyone.
Well, let's get into this on that front. We'll actually pick up right from where you left off, because we are, I guess, about a week and a half away from what is supposed to be entering stage 2 of the government's reopening plan. But I just checked the numbers, and I note that we have already hit the vaccination targets not only for stage 2, but also for stage 3. So my first question is, what are we still doing in stage 1?
Well, we are looking at all of the markers that we need to look at, but things are looking very positive. We have hit the vaccination targets thanks to two things. One is the people of Ontario for stepping up to be vaccinated, but it's also the incredible work that our frontline healthcare workers have been doing throughout, both in terms of caring for people in hospitals, but also for being a major part of our vaccination effort. So we're very, very grateful for that.
Again, I'll repeat the question, though. If all of those good things are happening, when we are eligible to be in stage 3, because we've hit those targets, why are we still in stage 1?
Well, we are looking at when we can move into stage 2. As you know, it's supposed to be July 2nd. But because things are looking so positive, we are reviewing it right now to determine if we can move forward a few days and get into stage 2 sooner than July 2nd. So we expect to have a statement about that very soon.
What would prevent us from moving into stage 2 sooner?
It might be the Delta variant, of course, is out there. That's something that we're really keeping a very watchful eye on. It's highly transmissible, and we've seen what's happened in places like Porcupine area, District Health Unit, as well as in Waterloo. So it's not something that we can take for granted, but we are working very hard to contain it.
How confident are you and the public health experts that you consult that we will, not can, but will avoid a fourth outbreak, and this time the Delta variant?
We are working very hard to prevent that from happening. It's looking very positive right now that we will be able to avoid a fourth wave, because we are now at 77% of adults in Ontario have received at least one dose. 27%, have received a second dose and are fully vaccinated. And we are really accelerating our efforts in 10 public health unit regions in Ontario that have more significant numbers of the Delta variants, to make sure that people can get vaccinated both for single doses and double doses there. So we're taking every step possible to prevent the Delta variant from causing a major disruption.
And the studies or the test results that you've seen, I just want to confirm this, show that the vaccinations that we have received to date will work against the Delta variant, even though it is considered to be much more virulent a strain than the original COVID-19. Is that fair to say?
Yes, it is fair to say that our vaccines are working against the Delta variant.
Okay, let's move on here. I want to talk about the vaccination program that the province of Ontario is responsible for administering. You pointed out a while ago, the news has been good. The government's vaccine system has been up and rolling. I am going to put, though, some of the criticisms I've heard to date about it to you and get you to comment on that, because there have been, as opposed to sort of one central place where people go to sign up, there have been numerous portals and, qualifications that people have to meet. And, you've heard all the same things I have about this being sort of computerized bureaucratic hell. And I think I heard Andrea Horvath the other day say it's like the Hunger Games trying to sign up. Overly complicated, too glitchy. Question, why did you not choose instead a single portal that everybody would go through rather than what we've had in place for the last many months?
Because we felt it was really important that local public health units be able to devise their own system. Some of them already had a system that was working well for them. Others relied on our central system, but I'm very proud of the fact that all the places that were administering vaccines were able to have them all registered in COVAX, which is really important to understand who's been vaccinated when and with what vaccine. And it's also consistent with the work that we're trying to do with our transformation of the entire health system, that it's not as decreed by Queen's Park, what shall happen, but really up to local areas, such as like Ontario health teams, in this case, the local public health units, to figure out what's best for their own geographic area, what's going to work well for the people of Ontario that live within their region. So we wanted this to be useful in every part of Ontario, and that's not according to one system.
I have heard, admittedly, anecdotal evidence about people showing up and being told, well, sorry, you may think you checked it out ahead of time, you may think you qualify, but in fact you don't qualify, so we're sending you home. Other people have talked about the fact they've had to stand in line for hours and so on. Do you wish it had all gone more smoothly?
Of course, there have been some glitches in the system, but I think overall, I'm very pleased with it. One of the changes or one of the issues that has an effect on the glitches is when you open it up to a new group of eligible people, such as today, where we're opening up to people in the 10 geographic areas that have the most COVID variants. You have everybody on the phone first thing in the morning trying to get a vaccine. What we are saying to people is please be patient, because generally speaking, as the day wears on, you won't have to wait as long. You will be able to book your vaccination time without having to wait for hours on the phone. So it's really just a matter of people hopefully being able to call back later, to be a little bit more patient. But our system that has been able to take hundreds of thousands of calls during a single day and book hundreds of thousands of appointments, the system has not crashed, which has happened in other jurisdictions. There have been glitches, yes, but I am very pleased with the way the system is working overall.
Minister, I know you get lots of compliments from people that you know about how well the vaccine rollout has gone, so you don't need me to do that. I'm going to take the other side of the coin, which is to read something Robin Urbach wrote in the Globe and Mail earlier this month. Here's a little snippet from a column she wrote in the Globe. She writes, "Then there's Ontario, which for the last almost year and a half has been a rudderless ship with a neophyte captain drifting wherever public opinion blows, usually with 2 to 3 week delay. Premier Doug Ford has incessantly repeated that nothing is more important than protecting the health of Ontarians and also keeping kids in school and protecting our seniors and supporting small businesses and safeguarding our economy, which together means that nothing has really been more important than anything else. The effect has been a government that lurches from celebrating reopening plans to issuing dire warnings about ICU occupancies. Nowhere else in Canada have children been out of school so long, have seniors been hit with 2 equally devastating waves, have outdoor activities been so restricted for months, have retailers and other businesses faced such extended restrictions. And in exchange for these sacrifices, the province can boast average case numbers and above average deaths." Okay, that's a tough piece, and I'd like to give you a chance to respond to some of the criticisms she made there.
Well, I guess it won't surprise you that I feel quite differently about the situation in Ontario. From the beginning, we've always said that the health and well-being of people is our utmost priority. And every step that we've taken has been with that in mind. We have relied on the advice of our Chief Medical Officer of Health, our Public Health Measures Table, the Science Advisory Table, and others. So our decisions have been based on science, on clinical evidence, and that's what we always defer to the recommendations of our medical experts when making decisions. There is no doubt that there has been a lot of economic pain as a result of some of the decisions that have had to be made. But I think that's unfortunately similar to what's happened in different jurisdictions. And of course, I am very sorry for people that have lost their businesses and that have had such or businesses and or their jobs. But at the end of the day, this is about saving lives. And this is what we have turned our minds to every step of the way, every day since COVID broke out in Ontario. We want to save people's lives, and that's what our decisions have been based on.
Now, of course, when you stood for election 3 years ago, you and your colleagues had obviously no idea that you'd be fighting a once-in-a-century global pandemic. So we understand that. It raises this question for me, which is, clearly you have had to learn hard lessons over the past year and a half, which presumably will be good for next time, because what everybody tells us is there will be a next time. If you could go back and substantially revisit a decision you made regarding fighting this virus over the last year and a half, what would it be?
I think what I would have wanted, and it's not really a decision, but it's a review. What I would have wanted to have seen was a well-documented pandemic plan and infrastructure for what we would need to do if we were faced with a pandemic of this magnitude. And that is something that this is not a judgment on any government at all. It's just that it would have been far easier to have been able to deal with the pandemic if we'd had, for example, an integrated lab system in place, if we had a well set up case and contact management system, if we had a system for developing the vaccination locations and types, to have had the information lines so that the labs can be contacted by the testing centers. All of those things would have been far more helpful for us to deal with this pandemic. But I certainly see that as my responsibility going forward to make sure that we document what we did during COVID and make sure that there is a pandemic plan going forward, because you're right. It's not a question of if another pandemic will happen. It's when. So we need to be prepared for that.
And can you tell us now with confidence that, given your experience of the past 15, 16 months, that whoever has to deal with this down the road next time will, in fact, be better prepared because of the experiences we've been through now?
Absolutely, yes.
Okay, we have that on the record. Let's play a clip now. We did a program not too long ago with some small business people, and we talked to one guy who owns a salon in Thunder Bay. Tony Muya is his name. And, you know, because of the government restrictions, which I take your point, you say have been necessary for the health of the people of the province, but because of them, he's been open 10 days this year for business, 10 days in 2021. And, well, let's hear from him, and then I'll come out of that with a question.
We've been a safe place since day one. We followed the guidelines that our local health unit, in conjunction with the provincial government, put into place. We spent thousands of dollars in plexiglass in between stations, front desk. We spent so much money on PPEs in our salon. There is nothing else that the government can put into place that makes our business any safer than what it was a year ago. It's been absolutely catastrophic, not just business-wise, but personally. What's happened for us is our numbers are so far down, it's crazy. What's worse, more than our numbers being down, is what the Ontario government has done to really ruin the importance of being a hairstylist or a spa technician in Thunder Bay. We are only 4 different businesses that are still closed in the gray zone. So many of my friends and I, we walk around and think, you know, we're almost better off dead than we are alive.
Now, Tony went on to say he's out $500,000 because he's had to been closed so long. He owes the government money. He's in therapy. His region, again, we checked these numbers this morning, his region has 9 COVID-19 cases. So I guess I want to know what your message is to him and his colleagues who have essentially been closed down throughout the pandemic.
Well, first, I would have to say that I'm sorry that this has been so difficult for him and for his colleagues, that this isn't something that we wanted to do. We had to do based on the medical evidence, and what we heard from the medical specialists was that in certain businesses there's much more proximity, closeness of people to each other, and that's what happens in salons and in places that do things like facials, that sort of thing. And that's why we had to take the steps that we did. I know there has been some financial assistance for people in Ontario, but I know for some people it wasn't available and that they've gone through very difficult times. But we are doing whatever we can to get as many people vaccinated as possible so that we can move into step 2, which is where salons will be allowed to open, and then into step 3, which will affect other businesses as well. So we watch this very carefully every day. We're not prolonging this for any longer than we absolutely have to. And we want people to be able to get back to their businesses, to get back to their jobs, to be able to get back to all of their families as well.
I do take your point on all of that, but Tony's view would be, I think, if I accurately characterize it, you're a progressive conservative government. You're supposed to be looking out for the little guy. He's a small business person in a rather remote part of the province of Ontario. He's the kind of person who he thought you guys should be looking out for, and he spent the money, he believes, to make his business as safe as possible. And yet he's in deep trouble right now. Do you think you could have done this issue differently and given folks like Tony a better opportunity to succeed, pandemic notwithstanding?
I think that it's something that we have, we've been relying on the medical experts to give us their recommendations about what's safe and what's not safe. And, at the beginning, we didn't have a vaccine. And so we had to take this very, very carefully, which we did. And I know that many people have suffered economically, which we've tried to deal with in terms of providing some economic relief, both in terms of some grants that are available, but also in reducing hydro payments and so on. But I know that people have reached the end of this. I know that people are very anxious to move forward. We do have, our Minister of Small Business has been looking at these issues since day one, have been asking many questions. It's not as if we say that nothing can be open and that's the end of it. We have very vigorous internal discussions about what can and what cannot be open based on the medical evidence, but also based on the precautions that people are taking in their businesses. So this is something that doesn't just go unstated. There is a discussion with our Minister of Small Business and many others, because we are taking a whole of government approach to all of this. And that it's really important to hear about what's happening to various businesses and what we can do to mitigate some of the effects of the precautions that we're having to take.
Now, I appreciate that, but I think people would be interested to know if, for example, the medical officer of health says, you really must do this, but you and your elected colleagues think, okay, we hear that advice, but we actually think it's okay if we do that. Can you do that?
Well, I would say we take the medical evidence very, very seriously, because none of us are doctors, with the exception of one, Dr. Marilee Fullerton, who's in our cabinet. But I'm not a doctor, and so I need to rely on their recommendations. And it's not just one doctor, it's a series of people who are epidemiologists and other specialists in these public health issues. So I would say that all of us have to rely to a large degree on what they tell us. Can we modify it sometimes? Can we speak to it? And can we ask questions about how we can mitigate some of those recommendations? Yes, we do that. But we always have to rely on the science and on the clinical evidence.
No, I get that. But at the end of the day, this is the thing I really want to nail down. At the end of the day, you're the decider, right?
Yes.
So the buck stops with you.
Yes, it does.
And if the medical officer of health says, Minister Elliott, I think you absolutely have to do this, but you believe, science notwithstanding, that he's wrong, or you may have other views as well that you take into account, you can overrule him and presumably have along the way. Yes?
I would say that I've had discussions with our chief medical officer of health, and there have been situations where I have wanted further information in order to understand why certain decisions are being made. So it's not something that just I hear it from the medical officer of health and therefore it happens. It doesn't work that way. There's an opportunity to ask lots of questions, and that's why I think it's really important to have that kind of relationship that I had with Dr. Williams, and now I hope to have, and I think that I will, with Dr. Moore, our new medical officer of health that's coming in, so that you can have that discussion, that you can understand issues, that you can ask if there can be mitigations or slight changes. That's the way it works, that you have to work together on all of this.
Dr. Moore, we should just clarify, is starting in a few days, and I wonder, could you tell us what you believe Dr. David Williams' legacy will be? When people look back at this time years from now, what will his legacy be to the past year and a half?
I think that Dr. Williams will have a very proud legacy, that he is the one that helped Ontario get through COVID-19 with respecting the lives of the people of Ontario, that he saved many lives with the recommendations that he made to us. And I am very, very sad to see him go. I have great respect for Dr. Williams, and I believe he did a great job. But I'm looking forward also now to working with Dr. Moore.
You no doubt heard the criticisms of Dr. Williams that he was kind of an iffy, sometimes even imperious communicator. What did you think of that criticism?
I think that we all have communication issues, but I think that it's the substance rather than the style that matters the most. And that's what I believe is the case with Dr. Williams. He had knowledge of public health for years that he put into great use as Ontario's Chief Medical Officer of Health during this really, truly unprecedented time.
Minister, I want to bring to your attention here something that Cynthia Mulligan, the Queen's Park reporter for City TV, has been doing since this pandemic began. And Sheldon, I'll ask you to bring up an example of this. She essentially retweets what your office puts out on social media. And here's an example under your name. Ontario's reporting 3,000 plus cases of COVID-19 and over 38,500 tests completed. Locally, there are 903 new cases in Toronto, 752 in Peel, 335 in York Region, 187 in Durham, and 150 in Ottawa. As of 8 p.m. yesterday, 6.1 million plus doses of the COVID-19 vaccine have been administered. That's what you tweet. And then she adds at the top, as people who can see this, and I'll describe it for those listening on podcast, she adds the death toll. 47 deaths is what she adds. So every time your office tweets out the daily cases, the vaccinations, and the test totals, she retweets and adds how many Ontarians died of the disease. And I'm just curious as to why, when your office tweets out those numbers, the death toll is not included.
Well, that was a deliberate decision that we made because I know that this has been very painful for many, many families, particularly families who lost loved ones in long-term care. And so that we chose to do that really out of respect for all of those who are still grieving.
Naturally, there are those who are not on side with your government who believe that the death count has not been included as a means of obscuring or minimizing the consequences of the decisions that the government has made. Could you speak to that?
Well, I certainly wouldn't agree with that. That information is available on our website on a daily basis. There's no attempt to hide anything. We're very transparent and always have been with the people of Ontario about everything that's happened with COVID. There's information daily on our website. There are briefings several times a week by the Chief Medical Officer of Health on their own without any politicians being informed, which I think is important for people so they can understand what questions are being asked and to hear it directly from medical officers themselves. We've had many press conferences as well, but we have been open and transparent with the people of Ontario in all respects concerning COVID-19.
Okay, we're down to our last minute here, and I'm going to ask you, I note almost every day I get a press release of some kind saying that another Conservative MPP is re-upping or standing for nomination to be nominated or something like that, but I haven't seen your name. Are you running again?
Yes, I am. I've already been nominated in Newmarket, Aurora. I feel very honored to represent my constituents there, and I have been nominated and I'm ready to go.
And you are definitely running for re-election a year from now.
Yes, I am.
Are there any circumstances under which you can imagine that not happening?
Well, there's lots of circumstances, but I hope none of them happen to me. You know, there's an illness. I hope not. But other than that, no, I don't expect so.
Okay. Minister, we're grateful for your time tonight here on TVO. That's Christine Elliott, Deputy Premier, Minister of Health, and the PC member for Newmarket, Aurora. As my dad likes to say, ministers, stay positive, test negative.
I like that. Thank you, Steve.
Last week, Hamilton City Council voted 9-6 in favor of moving forward on a $3.4 billion offer from the federal and provincial governments for a light rail transit system. 9-6 is hardly what you'd call a resounding victory for the pro-LRT side. Apparently, there are many in the Hammer who are still unconvinced the city either needs or can afford to operate this system. To discuss this, let's welcome, in Hamilton, Ontario, Judy Partridge, City Councillor for Ward 15, known as Flamborough East. Maureen Wilson, City Councillor for Ward 1, known as the Chateau-Coots area. And Ryan McGreal, editor of Raise the Hammer, an urban and civic affairs blog focused on the Steel City. And we're delighted to welcome all three of you to TVO tonight. We want to just start because I presume that many people watching us right now don't know the route this LRT would take. So let's ask our director, Sheldon Osmond, to bring up this graphic, and we'll show it. Now, remember, everybody, for everybody who lives outside the Steel City, the water is north in Hamilton. It's tucked under Lake Ontario, okay? I know it's west of Toronto, but it's actually under. It's south of Lake Ontario. So imagine the water is at the north part of this picture, and I'll describe it for those listening on podcast. The LRT would start at McMaster University in the west, that's in Westdale, and proceed essentially east along a path all the way to Eastgate in the east. It's practically Stony Creek, with numerous stops obviously along the way. It's an east-west route south of Lake Ontario through the heart of the city of Hamilton. Okay, that's the gist of the route that has been approved by City Council. This project has been a long time in the works. Ryan, let's start with you. There have been several iterations of the plan as we've gone along. What do you think of what is presumably the final plan on offer that we just showed?
Well, the interesting thing about this plan is that it is essentially the same plan that Council approved in 2013 when they designed this system and they submitted it to the province for approval. Now, the province came back in 2015 with a couple of slight changes. They shortened the eastern terminus a little bit to Queenston Traffic Circle and added a north spur to the James North GO station. Then in 2017, there was a bit of a crisis around the system. Metrolinx had determined that that north spur was a high cost for low value, and they ended up deciding to remove that and extend the eastern terminus back to Eastgate Square. So this is the exact project that Council developed and submitted to the province in 2013, and it has had a number of twists and turns along the way, but we're actually back now to a situation where we have full funding and a once-in-a-generation opportunity to build this thing. You
have full funding to construct it. Do you have full funding to operate it?
So the operational details haven't been finalized yet. It would have to go through an RFP process where consortiums would bid on the 30-year contract to construct and operate it. The understanding is that the city would pay the operating and maintenance costs, and the province would pick up the financing, life cycle, and insurance costs.
Okay, I'm going to pull an audible on our director, Sheldon Osmond, here and ask him for a two-shot of the two city councillors, Sheldon, because I want our viewers to be able to see how council has differed in its opinion on this. So let's see if we can get a shot of Maureen and Judy here. a two-shot of them because I want to find out how, there we go, I want to find out, Maureen, how did you vote on this project?
Oh, I've voted very much in the affirmative. It's a generational opportunity. It's a fiscally responsible thing to do, and it's about city building at its best.
Okay, hold off there. Judy, how did you vote on this?
Well, I voted to oppose it. It is a disaster. It is not going to serve the broader community of Hamilton. It is not going to connect all the communities together, which is what a transit system should do. It is certainly not going to get people to where all the new jobs are being created, which is in the airport, Ancaster, Flamborough, Stony Creek business parks.
All right, we have two obviously very different views and visions for this project right now. So let's dig into this a little bit if we can. Maureen, you like this plan? You think it works for Hamilton? How come?
Well, just in response to that, 3 points. You always build your rapid transit line where your ridership is the greatest. That's transportation planning, land use planning 101. The east-west corridor is the busiest transit corridor in the city of Hamilton and has been for decades. In so doing, by building this, we're going to enable better transit throughout. This is the spine of what in Hamilton we call the blast network. So it's integral to growing transit service and better transit service throughout Hamilton. And downtown Hamilton it has the greatest number of employees in all of the city. So it is a very active employment center in and of itself.
All right, let's go back to Judy. Judy, you said a moment ago it was a disaster. Let's put a little more flesh on that bone. It's a disaster because why?
Oh, absolutely. I'm happy to put some meat on the bones. It's a disaster because it is going to be the entire route where the earthworks, when they start this project, it is not going to be done in phases or sections. It's going to be the entire length of the route. So you're looking at 14 kilometers right through the heart of the city being churned up. At the same time, you've got the big arena downtown, which is First Ontario Place. The whole entertainment district is going to start under construction. So, people won't be able to get in and out and move around in the city.
For how many years?
Sorry, go ahead.
For how many years?
Oh, so right now they're probably talking 5 to 8 years. I think we're looking at 10 years. If this goes ahead and gets built, you're not going to have the first riders on that train going through the middle of the city for many, many years to come.
I asked this other follow-up because literally 100 yards north of where I'm sitting right now, there's a $6 billion LRT going across Eglinton, and it has certainly messed up Eglinton for many years in the past and likely will for another couple of years in the future. But at the end of the day, there's going to be a spectacular LRT going across Eglinton all the way from the west of the city to the east. Now that's here. You can debate whether it's worth paying the price of all that disruption for what you're going to get at the end of the day. Why are you not sure that all the disruption Hamilton is going to go through will be worth it at the end of the day?
Well, I think you have to look at what are the other cities doing. We're constantly being compared to Kitchener-Waterloo, to Toronto, and to Ottawa. And geez, look at how wonderful those systems are working. Well, those cities invested in building their ridership for many, many years. They had bus rapid transit, BRT. They started with that. Ottawa is a prime example. They connected, similar in geography, they connected all their outlying communities right into the downtown of the city. They built their ridership. Hamilton's ridership has been flat for many, many years. And instead of going the route of the BRT, which, by the way, would feed into the blast network and connect all the communities within the city of Hamilton, because don't forget, we've got 2 escarpments that we're dealing with here. So it's not that easy. You're never going to get the LRT to go up the escarpment on either side. But a bus rapid transit is movable and you can. And by the way, the task force that was established by the province never recommended LRT. They recommended higher order transit, of which BRT is.
All right, Ryan, let me do a little fact checking with you here. We've heard estimates just now that this could take 5 to 10 years of disruption before completed. Do you think that's accurate?
No, I don't think that's a realistic estimate at all. If they were to build the entire system in one shot, the way Waterloo did, and kind of a painful tear off the Band-Aid, it'll probably take about 3 years. If they decide to build it in phases where they take, say, a half a kilometer at a time, that will take longer, say up to about 5 years, but it will mean less disruption to the entire corridor in the interim. Certainly in the past, that was the approach that was being looked at for Hamilton. Ultimately, it'll come down to what the consortium that gets the contract to build it decides to do and the direction they get from Metrolinx.
Maureen, what's your understanding of how long this would take?
My understanding is similar to Ryan's. It will be determined by the consortium whether they want to do it all at once or whether they want to do it in phases, and where they start and where they begin. Any infrastructure project requires the town where it's going in to adjust, but it is an adjustment that is worth making. Let's just be clear here. The federal government and the provincial government said that BRT, bus rapid transit, is not on the table. It's $3.4 billion in a public investment in a mid-sized city. There has never been a deal like this on the table for a city this size, nor will there be again. It is fiscally irresponsible. It is environmentally short-sighted to reject this generational investment. And I am very grateful to the federal and provincial governments for the confidence they have expressed in this city and in its future, and doing what this city asked in the reports that Ryan cited. We supported this plan. We put forward this plan for funding, and it is on the table, and it remains on the table, and I'm grateful for the investment.
Judy, can I get you to speak to that angle? It is not every day that the federal and provincial governments of Justin Trudeau and Doug Ford agree on anything, let alone to give more than $3 billion to a mid-sized city for a new LRT. How do you turn down that kind of money?
Well, I don't think you would be turning it down. I mean, we've got a history of pushing back on governments and being able to negotiate and work things out. And by the way, for a federal minister to come out and say, just a few months ago, the federal government interfering in municipal decisions around transit would just be wrong and we wouldn't do it. Well, guess what? She came out and that's what she said.
This is Catherine McKenna you're talking about?
I'm talking about Minister McKenna.
Yeah.
Yes, exactly.
Who's from Hamilton originally?
Well, be that as it may, really doesn't mean anything with this project. So I'm very concerned that any government of a higher level would dictate to a municipality what they should be doing in terms of transit. Transit, and to speak to the climate change angle, how are you going to get to the LRT? You have to drive to get there. But oh, wait a minute, there's no parking lots. So you can't park your car to get on it. And what about connecting buses to it? The LRT line in Hamilton runs down the center, as was said before, down the center of the city. It doesn't connect to GO. It doesn't connect to anything. And if you look at, again, Ottawa, Toronto, even up in Kitchener-Waterloo, it connects to the GO. There's loops involved. That's not happening in Hamilton, and I think it's very poorly planned. And when Metrolinx came in and gave us an update just a couple of weeks ago, they were very clear that they would decide on the construction, when it would be done, how it would be done. And they very clearly said to all of council, we were all listening, that it would be the earthworks that would be done first, and it would be done on the entire line.
All right, let me get Ryan back in here for a sec. Ryan, the all or nothing nature of this, how is that playing in Hamilton in your view?
Yeah, I really need to push back against Councillor Partridge's characterization. The idea that the federal government interfered or meddled in a municipal policy is just wrong. Going back to 2007, this LRT plan has been developed and directed and ratified repeatedly by council over literally 60 or 70 votes. The plan that was submitted to the province for funding in 2013 is the plan that the federal government stepped in to help fund in 2021. So it has been council who has dictated what this plan should be. The reason it's an LRT plan and not a BRT plan is that the city didn't submit a BRT plan. And the reason they didn't is that the city staff determined, and Metrolink's benefits case analysis confirmed, that BRT would have a lower capital cost, but a higher operating cost, less ridership growth, less new transit-oriented development, and fewer overall benefits. So I really have to push back on that. This is a plan that council is being given an opportunity to take yes for an answer to a plan that council submitted. Well, okay, but Maureen, let me raise this issue with you. Everybody on this call knows that Bob Rettina, the former mayor of Hamilton, now Liberal MP, said he's not going to run again for re-election for the Liberals because in his view, here's the quote, major funding decisions can occur on the whim of a minister who has consulted only like-minded individuals. He is not happy about the fact that, as he puts it, Minister McKenna has essentially made what, in his view, is a unilateral decision, and therefore, he says he's not running for the Liberals again and is going to bow out of federal politics. What do you make of all that?
Oh, I'm sorry. Did he resign as a matter of principle?
No, he says he's not running again.
No, he's still staying on, and he will collect his pension as such. And Mr. Rettina's position on LRT has been inconsistent at best. Let me just say this about the federal. If you want to be an elected official and play chicken with the federal and provincial government, over $3.4 billion in public investment, that will be on you, and that will be on you and your constituents to judge whether you believe that is the responsible thing to do. Federal and provincial governments put conditions on their transfers to municipal partners all the time, and they involve themselves in transit positions all the time, whether it be electric buses or LRT or subway, like in Toronto. This federal government and this provincial government is doing exactly what this council asked it to do, and is exactly what the studies are where they landed. And in terms of a fiduciary responsibility, they understand clearly, perhaps more than some of my colleagues, that this plan and LRT gives the greatest return on investment. It gives the greatest potential for transformation. It supports our efforts to try and grow in a urban dense way, so we can cut down on greenhouse gases and the cost of sprawl. It enables us to redo our subsurface infrastructure that, instead of falling on the backs of local taxpayers, it's going to be spread out across the country. I mean, all the boxes this checks. And I just think it's highly irresponsible to suggest that we can maneuver our way and negotiate with a federal and provincial government of two political stripes and suggest that we can do something other than LRT. Okay, LRT is on the table.
Let me just say, in the interest of full disclosure here, we did invite MP Rettina to come on the program. He declined to do so. He said he didn't want to get into a spat with city councillors. His big issue, in his view, is interference by Minister McKenna in the process here. Judy Partridge, I'd like you to comment on that, only because, Minister McKenna is born and raised in Hamilton. She knows the lay of the land better than, say, if she were approving a plan in some other city in some other province. I wonder if you think that gives her added credibility to be involved in the way she has been.
Well, no, I don't. Not at all. I think it's an irrelevant point. I would like to comment on MP Rettina, though, and let's be respectful. The man has been very consistent in his position, and to knock him on a TV show when he isn't here to defend himself or speak to himself, I think is really unfortunate, and it's really disrespectful. Minister McKenna, governments, whether you're federal, provincial, municipality, the history is that you all work together. You don't interfere. You don't take away decisions. You work together and you come up with what is the best plan. And growing up here or living here for 8 years when you were a teenager does not make you knowledgeable about the current state of our transit system. There were a lot of people who were chirping in her ear on the yes side. that it was going to be the best thing for our city. But the cost to our taxpayers, and let's not leave taxpayers out of this. Come on. We are here to represent our taxpayers, for gosh sakes. And the cost to them, we don't know what the operating costs are going to be. We don't know how much is going to be charged for the fares. We don't know what the maintenance costs are going to be. Heck, we don't even know if the $3.4 billion is going to cover the capital costs. And I really put a big question mark on that. I mean, just look at the cost of everything. It's gone crazy during COVID. How can anybody say that the $3.4 billion is going to cover the cost of the capital? We thought $1 billion was going to cover the cost of capital. And I want to touch on the 70 or so votes that council has had that people keep throwing in our faces. 95% of those votes were to receive reports. They were nothing more than that. It was not a vote, a yes for LRT. So let's be clear on that. It's just silly to keep going down that road.
All right, Ryan, let me get you back in here and talk about the issue Judy just raised on operating costs. It is today, as we sit here, a fact that the federal and provincial governments have said they're going to pony up $3.4 billion to build the thing, but they haven't said, and we have to presume, I suspect, that they're not going to contribute anything to the operations of the system, because the province puts next to nothing into operations of transit systems. Certainly the one here in Toronto is almost all fare box funded. So what can you tell us about how this system would be operated in the future and who would pay for it?
Sure, absolutely. So right now, and when I say right now, I mean pre-pandemic, because obviously the last year has been a bit crazy for transit systems. But pre-pandemic, we had 4 main bus lines serving this LRT corridor. They have a gross operating cost of $33 million a year. And after fare box recovery, they have a net operating cost of about $18.2 million a year. Now, for comparison, in Waterloo Region, their LRT system, which is about 18 kilometers, it's a little longer than Hamilton's, it has a gross operating and maintenance cost of $8.5 million a year. This is one of the great things about LRT. It costs more to build, but it's actually cheaper, much cheaper per passenger to operate, because you have one driver and one vehicle that can carry 2 or 3 times as many passengers as an equivalent bus. So the staff and Metrolinx that presented information to council, I think it was last week, they suggested that if ridership only grows by 8%, and if some of the current service on those bus routes is removed, if one route is removed and if the other 2 are reduced by 1/3, you would look at a net operating cost of $6.4 million a year. Now that's assuming very conservative ridership growth, and it doesn't take into account all of the added uplift in economic development, adding, in Waterloo, they've got tens of millions of dollars a year in new property tax revenue along their LRT line. That's money that Hamilton would be looking at as well.
Okay. Judy, what's the annual budget for the city of Hamilton?
So the annual budget for the city of Hamilton right now is $1.6 billion, and that's capital and operating. I mean, it's quite huge. But I want to, and I think.
Well, hang on a sec. Hang on. Here's the reason I ask is, in a $1.6 billion budget, you don't think you can find $6.5 million to operate an LRT?
Well, it's not $6.5 million. We don't know what the cost is. It's all speculation, and it's projections. We do not know the costs. And we've been waiting for a memorandum of agreement to come to the table, to have some costs attached to it. We have been waiting for that for about 6 years now, and we keep getting promised it's coming. Well, then it got canceled. So, okay, that's fair. Take a couple of years out of that. But they're all speculated costs, and you cannot compare Hamilton to Kitchener-Waterloo or any other city. Our demographics are completely different. The downtown demographics, there's supposed to be an affordable housing component tied into this. Well, define affordable housing. Minister McKenna has not defined affordable housing. We'll figure that out later. Well, what's affordable? If you think, what normally would be an $1,800 a month apartment is going to be $1,500 a month, we have residents who are paying $500 and $600 a month, and they're on social assistance. They can't afford anything more than that. That's not what's going to be built, and we don't even know what is the minimum. What is the minimum amount of affordable housing that is supposed to be built along that line according to the agreement with the federal government? We don't know any of that.
All right,
So
let me
our
get back to Maureen.
demographics are very different.
Let me get back to Maureen Wilson now. How confident are you that the operation costs of this system will be, as quoted, $6.4 million a year?
Yeah, in Hamilton, too often we practice what's called Hamilton exceptionalism, meaning we're so unique, we're so different, we can't possibly learn anything from anyone. And what lessons and practices apply somewhere else could not be imported here. And I think what Ryan has referenced are we have models in which to look at operating costs and which to get those estimates. And he has cited them very well. The interesting thing also about the comments on operational is we never apply these expectations of costs to any other infrastructure project. We didn't apply it to the Red Hill Creek Expressway, which I think in 2000 and last year we spent close to $12 million just resurfacing. Unlike other hard infrastructure investments, when you put light rail transit in the ground, development follows in and around it, and it increases the value of the land, which in return increases the revenue take for the city. So on all of these fronts, including what happened in Kitchener-Waterloo, where they enjoyed $2 billion in assessment growth, even in advance of that line being finished, and now they're going into phase 2 to build some additional LRT. It is transformational. It does enrich the city's coffers, and it does it in such a way in an already urban serviced area. So you're not going to be generating forever operational costs. And that's exactly what sprawl does. It's forever a liability.
All right, with just a few minutes left to go here, let me really complicate this story and muck it up entirely, okay? Ryan, I've talked to people in Hamilton who are okay with an LRT, but they think the route is wrong. They think it should have been from mountain to downtown, north-south, as opposed to east-west. That if you were going to build one, that's the route that should have been chosen, and there would be more support for that. What's your position on that?
So it's a really good question, actually, and it's got a really good answer. There are essentially 3 main success criteria for an LRT system. Number 1 is that you have to have strong existing ridership. You have to have a baseline of people who are going to be using transit. Number 2 is you have to have a lot of opportunity for ridership growth. And number 3, you have to have a lot of opportunity for new development. Right now, the B line, that east-west corridor that you saw on the map, that has all 3. In fact, the city, despite turning down 90% provincial funding for a light rail system back in 1981, and that system ended up going to Vancouver as their SkyTrain. In 1986, Hamilton Council realized we need to add ridership along this B line, or to add service. So they established an express bus line, and they've been growing ridership on that route for decades. That's why that was picked as the first route for LRT. I think an A line running north-south makes a lot of sense, but the city has some work to do first. We have to build up transit service, and we have to build up ridership along that second corridor in order to get ready for rapid transit as well.
Okay, Judy, I got a little time left and 2 quick questions I need to ask you. Number 1, if they'd gone for north-south instead of east-west, would you be more supportive?
If we had bus rapid transit, we could do north-south and we could do east-west, and we could grow the HSR into areas that are not being served. We have areas throughout the city that are not being served adequately with transit. And until you do that, you're not going to grow your transit. So, it's such wrong thinking. If we went with bus rapid transit, which by the way is what Kitchener-Waterloo did first, and still have a BRT line running into Cambridge, if we had done that, we could have connected the entire city at less cost. That's what makes more sense.
Okay, that's first question. Second question is there, put it this way, Hamilton's population, which I think is what, between like 500,000 and 600,000 right now, maybe closer to 600?
580,000, yeah.
Okay. It's expected to grow by 40% within the next 30 years. That's pretty massive. Can the roads in Hamilton accommodate all of that extra growth if you don't build this LRT?
Well, first of all, I agree. We cannot do sprawl. It just makes no sense to expand our urban boundaries when we have available land within our city that we could build up in density. That's what we should be doing. So in terms of accommodating, can the roads accommodate it? Yes, I absolutely believe that they can. And again, we've got areas of our city, both upper and lower, where we can do the density internally. The infrastructure is already there. We might have to increase the size of the infrastructure as sewer and water, but you know what? That is where we need to focus our growth.
Maureen, last word to you. I got about 20 seconds. Can the city handle the growth if it doesn't build the LRT?
Well, it would mean another generation of expropriating land, expanding laneways, and it would mean a less livable city. It would mean a city where air quality is compromised, particularly for our young people. So I'm hoping that we have learned the lesson that sprawl costs financially. It costs a lot of money. And if we have in excess of 200,000 people coming into this region over the next number of decades, we have either two ways we can handle that. We can grow out, which is, as Councillor Partridge has acknowledged, is financially irresponsible and it's not sustainable, or we can grow within the urban boundary. And what
the one thing I can't grow is the clock. I'm plumb out of time. City Councilors Maureen Wilson and Judy Partridge and Ryan McGreal from Raise the Hammer. Thanks, all of you, for coming on to TVO tonight. We're grateful.
Thank you.
Thank you very much. Very grateful.
And that is the agenda for Wednesday, June 23rd, 2021. Tomorrow, we wrap our season-long joint TVO Toronto Star initiative, The Democracy Agenda, by talking to writer Margaret Atwood about democracy's fight for survival. Also, we'll get some constructive advice for improving democracies worldwide for the 21st century. I'm Steve Paikin. Thanks for watching TVO, for joining us online at tvo.org, and we'll see you again tomorrow.
The Agenda with Steve Paikin is made possible through generous philanthropic contributions from viewers like you. Thank you for supporting TVO's journalism.